What should parents be saying to their kids or teens about substance abuse, and what age should those conversations begin?
Right. I think it's really important to remember that kids want information. So if they're not getting information from their parents or a reputable source, they're going to get information from their friends, and they're going to base their decisions based off the information that they get. So I think it's really important for parents at every stage, from when kids start talking to, through their 20s, to really have honest conversations about what substances are and what they do to your body. We talk a lot to younger kids about toxins and drugs and how they're chemicals and how they kind of react in your body. But if you haven't had a conversation with your teenager yet, I think it's really important to just say, I'm hearing about this, and what are you seeing? And that conversation is a whole lot more comfortable than what are you doing, right? So a kid might be more likely to say what they are experiencing or what they're seeing their friends do or people that they know in school, instead of what's kind of personally happening for them yet. So that's a really good way to start it. What are you seeing in your school? I'm hearing a lot about, kids drinking too much. What's your experience with that? What do you know? Tell me, because I'm clueless, and it's okay for parents to feel that way.
And I think sometimes parents might have sort of a misconception that if they initiate these conversations with their child, they're going to start planting ideas in their head, and they're somehow going to trigger something they haven't already been curious about.
Right. And that's really interesting, because we know that kids have access to so much on their mobile devices, on their computers, through their networks with friends. I mean, if a kid really wants to learn how to smoke marijuana out of a bong, they really just need to, put it in the computer, and there'll be a million videos on how to do it. So I think it's really important for parents to understand that they want information, and they're going to make the decisions based on the information they have, and we want to give them the most accurate information so they can make the safest decisions.
If your child starts asking you about your own substance use, how should you handle that?
So oftentimes what we tell parents to do is kind of really reflect that. So it's, great that you're asking what I was doing. I'm wondering if that's something that you're thinking about. Are you trying to make a decision based on the decisions that I've made? You could say things like, I've learned a lot about the decisions that I've made, and it's kind of guided me to this point, and right now I'm really thinking about you and kind of what you're thinking about. So that reflection is really good. Depending on the relationship that you have with the parent, the parent and child, some parents might not want to disclose that they've used certain substances because they might feel like it would give permission to do that, but I think that parents know their kids best. But I think if a kid is asking, that's a really important moment for a parent to recognize, my kid's thinking about this, and my kid's trying to make a decision about this, and really kind of reflect that back on the child. Sounds like you're thinking about this. What, where are you at with it?
I would think it would be kind of hard to strike a balance, because you want to keep the channels of communication open, but you probably don't want to fall into actually seeming like you're condoning the behavior.
Right.
So how do you kind of walk that line?
Right. I think kind of setting really clear expectations for behavior is really important. And we do that, with kids at all different stages. So as kids are starting to enter middle school, those conversations need to be as common as, don't touch something that's hot that we had with our 2-year-olds. So because alcohol is so available, because drugs are so available, parents need to be really honest about, this is what these substances are, and these are our rules about it. So the expectation is that you won't drink alcohol until you're 21, and the expectation is that you won't use cigarettes or other drugs, because here's why, and start giving those lists of reasons.
There may be a tendency too for parents to sort of excuse if their child is maybe has a drink or smokes some marijuana. Is there a danger in normalizing substance use?
Absolutely. I mean, the bottom line is the behavior is illegal. So if you are approving illegal behavior, that sets a precedent for lots of other behaviors that, young people can engage in that are high-risk behaviors. So as a parent, it's really important to kind of really hold that line. It's illegal, it's unhealthy. And again, we know the younger that kids start using, the more likely it is that they're going to have a lifelong addiction. And we want kids growing up to be happy and healthy and making good decisions and not needing, the services and treatment of, in their 20s and 30s and 40s and really struggling with some addiction.
if you have seen some of these signs, what should your response be? How should you handle talking through your suspicions with your child?
So that can be a really hard conversation. So what we encourage parents to do is really just be honest about it. So these are the concerns that I have, these are what I'm seeing, and oftentimes the first reaction that a kid is going to say is, absolutely not, I'm not doing that. So it might be more than one conversation until a child is really ready to share whether or not they are using or not. Reaching out and using community supports that are in place is really important. So that might be an appointment with a primary care physician, getting that kid in to talk to just a primary care doctor, using insurance as far as counseling for drug and alcohol, helping kind of make those referrals, and getting an assessment is what it's called from a drug and alcohol professional who can really meet with your child and ask them some questions and really review what's going on and really kind of make some treatment recommendations.